Hello and welcome to OneMedicine. Today I'll be talking about Incontinentia Pigmenti, one of the pigmentary disorders seen in dermatology. So basically it's an rare X-linked dominant multisystem ectodermal dysplasia. So it's an X-linked dominant disease which is an ectodermal dysplasia. That is, all the ectodermal line structures will be affected here, usually which is lethal in males and present classically in females with the female fetuses will have skin lesions, teeth abnormalities, alopecia, nail dystrophy, ocular and neurological findings. It is a rare condition, so it is seen in 0.6 to 0.7 per lakh of the population, and females are mostly affected than males. Pathophysiology. There's mutation in IKB-KG gene which encodes for NEMO. NEMO is basically nuclear factor kappa B essential modulator. So this IKB-KG gene encodes for this NEMO factor. That is mutated here. Activation of genes which is involved in inflammation, immunity, cell survival takes place. These incontinentia pigmenti cells also are highly sensitive to the TNF-induced apoptosis, leading to development of skin, retinal, CNS lesions in patients. So this is an X-linked dominant disorder, as I told you before. The mutations can be inherited from an affected mother, or it can occur de novo also. So most male fetuses which are affected with loss of this mutation, they are miscarried. Female fertility is normal except for the miscarriages that are seen here. And the genetic prenatal diagnosis can be done. Clinical features here. It presents perinatally with erythematous vesicular rash which follows Blaschko's lines. The disease is seen in certain stages like stage 1, 2, 3 and 4. In stage 1, there will be only bullae or the bullous stage. Stage 2, the lesions go on to form verrucous type of lesion, that is warty type of lesions will be seen here. In stage 3, there will be hyperpigmented streaks or whorls along the Blaschko's line again. So incontinentia pigmenti, if you are diagnosing this, you should have it in mind that these lesions follow Blaschko's lines. And in the stage 4, there are pale, atrophic, hairless linear streaks on lower extremities. So it is bullous, then verrucous, then hyperpigmented streaks or whorls, then it is a pale, atrophic, hairless linear streaks which are seen. Okay, that's the stages in which it evolves. The extracutaneous manifestations seen here are ectodermal dysplasia. So all the ectodermal structures would be affected. So the patients can have delayed dentition, missing or malformed cone-shaped teeth. They can have onychodystrophy. Alopecia can be present, that is loss of hair. Abnormal retinal vascularization and its symptoms can be present. And CNS features like the patient can have microcephaly, seizures, neurocognitive impairment and motor impairment also. So if you find all of these features, not everything can be present in one patient, but if you find characteristic skin lesions along with some ectodermal dysplasias, then you can diagnose this condition, and mostly it follows the Blaschko's lines. So here you can see the lesions present here on the limb of a child. So these are some bullae or vesicular type of lesions which are seen. You can see the hyperpigmented streaks here and the hypopigmented streaks here. Okay, so that follows the Blaschko's lines. The alopecia because of this, and the malformed conical teeth in the mother of a patient. This is mother of an incontinentia pigmenti child, and this is the alopecia seen. So here you can see the nail dystrophy also. Differential diagnosis in stage 1, that is the bullous stage. Other bullous dermatosis needs to be differentiated. Like in children, we can have bullous impetigo-bacterial infection. Then epidermolysis bullosa can be seen in infants. There will be friction-induced blisters in epidermolysis bullosa, mostly in children. Then herpes and varicella infections can be seen. In stage 2, the verrucous stage, again you have to differentiate it from the warts, epidermal nevus syndrome, which can again present as a verrucous linear lesion. Then stage 3, you have to differentiate it with any linear and swirled pigmentation. If you get any other condition which presents similarly, you have to differentiate it from that. And stage 4, you can differentiate from scarring or iTOS hypomelanosis. Okay, that's how you differentiate and find out the diagnosis. Management, there's no specific treatment for this condition. Symptomatic management, whatever the patient comes to, whatever stage, you have to manage it like that. And treatment of blisters needs to be done. Ophthalmological evaluation for retinal vascularization needs to be done. Pediatric orthodontist opinion for the malformed teeth present. And neurological opinion also needs to be taken. Mostly pediatric neurological opinion has to be taken for this condition. That is a treatment of incontinentia pigmenti.